Thank you, amigos, for coming to Matan to visit us. Of course, you may want to know a bit about this hospital and myself. I'm Brother Günther Närlich, a Comboni missionary, and I was sent to Matan in 1998. I found a hospital very vital, very active in its services, with a very strong primary health care component, but also we have the inpatient as such, surgical ward, medical ward, we have children's ward, tuberculosis ward, which has been quite vital because it's a disease, the tuberculosis in this area, very common. And then also we have the maternity ward, of course. Over the years, it has grown, this hospital. Currently, we have 250 beds, and it belongs to the Catholic Diocese of Moroto. The bishop at that time, he was looking for funds to enlarge a small health center which was started by the Comboni sisters, and looking around where he could build a hospital. Eventually the people here in Napak, they were generous to give land so that he could utilize the funds for the buildings. Solid buildings, and they make us happy because also the plan unites this hospital. Already the structure gives a certain organization. Currently we have 8 doctors. We have 6 intern doctors who are coming just for surgery and obs and gynecology. The other aspects we don't have yet. Specialties we shall eventually develop. Pediatric, next year we hope that a specialist comes, so we have a pediatric doctor also here who may be able to help these young doctors for their practice. We see a lot of disease outside, communicable diseases still, because of hygiene-related issues. Water is an issue. People do not have enough, let us say, available water nearby. They have to fetch it from far away. Sometimes boreholes break down, and so that is a big problem. We have malaria still, strange enough, in this dry land, but it is not always dry, and that is another big health burden for the population here. But also the other diseases come up, these acquired diseases, maybe with more civilization, whatever you call it, a different lifestyle. So we have also high blood pressure, cancer patients, which is painful sometimes to see patients who cannot afford also to be referred to other places. So we have to give also the palliative care, which is another aspect which is also costly. Yeah, to run this hospital is a big challenge because people cannot afford user fees. In fact, it's about 20% nowadays. We are really, since last year, we made a big leap towards a bit better, let us say, returns. 20% of the funds needed will be, let us say, supported by the users. Then we have some other health programs. Government supports with DHC conditional grant, which is not even 10%. So at the end, 50% we have to look from donations and outside, which is a challenge how to sustain the services. So we really have to try now more and more how can we get also support from within Uganda so that the services can be delivered. I believe very strongly this is a place of healing. It's a calm place. If we get funds or some well-wisher somewhere says, okay, we help you, because we have the, let us say, dedicated staff. We have people who are trained properly, and they are giving services even to half of what government pays their staff. And that is for me something very touching. So our staff, they donate kind of half of their service for their patients here. So what we dream of, which should come very soon, is a specialized care unit. We have a strong maternity, and even people from outside could come and feel and experience this healing atmosphere. So they can be given a surgery here. Hopefully they can support the hospital with at least the cost what we have to find in order to give them the medical care. The services are good. We have 0% of infection rate, especially after cesarean sections, which is another indication that health and hygiene is guaranteed here, and so many other good aspects I couldn't even mention. We also try for our staff when they have their basic training, to send them for further training so that we get specialized staff. And even there, we hope, of course, to give better care. It's a bit a mix of everything. I could talk along, of course, about this wonderful hospital, this reality, with big patient load, but we are ready to serve. And especially you get in times of holidays, people from all over Karamoja, because the hospitals, health centers, Christmas, Easter time, they are compromised. They are not functioning all at that level. Here in Matani, you find always doctors, personnel is available, we do emergency, anything what comes 24 hours. And that makes people to know that when I have any issues in Matani, I find always help.